Hello, hello, hello. Welcome to today's session, and my name is Daniel Garang. Of course, my name is Daniel Garang. Okay. And today we'll be talking about a very important topic. It's a clinical practice for medical students. Okay. I'm a medical student myself. I'm a fourth year medical student. And therefore, I would like to share a little bit things that I learned during my study in medical school for you to understand. For those who don't understand, then we'll start from the very beginning. And our topic today will be terminologies. Terminologies during clinical practice, right? Okay, terminologies of clinical practice, right? Okay, clinical practice. First of all, now we should define, or we should know, what is clinical practice. Clinical practice, right? Because if you are a new student, then you might wonder, what is clinical practice? Good. If that question is in your mind right now, then let's go together and answer that question for you. Clinical practice mean the application of clinical knowledge to diagnose, identify, if you may call it, and finally investigate and treat the disease, right? That's a long thing, right? But now I can simplify it for you. Clinical practice is when we approach the patient and we want to identify what's the problem with the patient. So we find out exactly what's wrong with the patient by using our clinical knowledge, medical knowledge. Then we diagnose the patient. We identify exactly what's wrong with the patient. And finally, we investigate by different means of laboratory investigations, and we treat the disease, or we treat the patient, right? The correct forms is to treat the disease, right? We treat the disease, we don't treat the patient. Or someone may tell you, we treat the patient, we don't treat the disease. Either way, you understand now what I mean by clinical practice. So clinical practice basically is the usage of the knowledge, medical knowledge. Let's say, if it is not clinical knowledge, then let's just call it medical knowledge. Clinical, or between two brackets, medical knowledge to treat disease, right? Now, to identify, diagnose. Treating disease is pharmacological approach, right? Now, it's too much for you to handle right now if you are the first year student or second year student, but now if you go ahead and break it down, there are a lot of terminologies in clinical practice that we should know. Terminologies, and the word terminology means the word that is not from English. It's the word that have a different meaning from other languages. So we make them terms to something else. So terminologies. Now the first one is health. What's the health? If I may ask, what's health? Everyone wants to say, all the time we talk about health. I want to be healthy. I am healthy. I have to go and play football to be healthy. I have to make some exercise and go. Of course, nowadays I'm going to the gym. Why? Because I want to be healthy. Now, what is health? Can you define health? The definition of health, let's define it. Let's just bring it down. Health is a state, excuse my spelling, state of complete physical, mental, and social well-being. Okay, great. There you go. When we talked about the health is a state of complete physical, mental, and social well-being. Great. Now it means if you are physically fit, it doesn't mean you don't have disease. If someone is fit physically, it doesn't mean you don't have disease. If you are mentally ill, if you are coherent and you're mentally not ill, it doesn't mean you don't have disease. If you have a social problem, it doesn't mean also you don't have disease. Therefore, short and brief, we'll talk about these things later. But now, for short and brief, that's the definition of health. That is the definition of health. And in fact, this is the definition that is accepted, or even it was even invented by, or created, let me just say created by who? By WHO. Wow, what is WHO? Some people may ask questions, what's WHO? I know you guys have been to high school, and a lot of you know these words, what they mean, and for the sake of some who may not know what it is, they may consider it to be the word in English, who are you? Who are you? No, who are you? Okay, so now let me stop being silly for a while, but WHO means, the word WHO means what is abbreviation of World Health Organization. Okay, that's abbreviation of WHO. So WHO define the health as health is the state of complete physical, mental, and social well-being, and not merely the absence of infirmity or disease. Okay, well, the other terminology we want to talk about is pathology. What is pathology? When we say pathology, let's divide in two words. Patho is suffering, means suffering, and logy means study. So it is a study of suffering. In other words, the complete meaning, it is a study of disease. Okay, so that's what pathology. And during your study in this school, medical school, you will learn, one of subjects that you will learn is pathology that deal with disease. So that's the meaning of pathology, right? Okay, so the exact meaning of the pathology, or definition of pathology is the scientific study of the nature, origin, progress, and cause of disease. That's exactly the pathology, right? And always sometimes says that disease is classified into two categories, and I think it's not important to you right now, but just so that you're familiar with it, it's divided into infectious and non-infectious disease. So when we talk about infectious disease, like TB, like pneumonia, malaria, these are infectious disease because there is a causative agent that get into the body and cause disease, and the body becomes sick, right? Some are non-infectious, like diabetes, like hypertension. These kind of diseases actually have, they more or less, they have some correlation with genetic background, and not exactly with infectious disease per se. So that's why we divide it that way. Okay, so now so far we define two broad terminologies. One is health, okay, right? One of whom is health. So at the end of this video, you have to know how to define health. So for example, I put it for you. What is health? Now you can define health. Number one. Number two, what is pathology? Okay, we define that one. Let's go to terminology number three. Number three is infectious disease. Infectious disease. So what is infectious disease? We say the disease is infectious if the disease can be transmitted or it can spread from one person to another person, and that such disease can be caused by microorganisms which they invade the body, like the malaria. If you are in the malaria endemic area and then you will be stung or bite by mosquito, an Anopheles mosquito, then you will develop malaria. Okay, and therefore infectious disease is very important. We have no infectious disease, and the definition of infectious disease is, the infectious disease are the disease that can be transferred or can spread from one person to another person and they are caused by microorganisms, some of which are TB, HIV, typhoid, syphilis, you name it, a lot of it. Okay, and therefore the following one will be, what is non-infectious disease? If there is infectious, there is non-infectious. Of course, that's not always the case, but okay. Non-infectious disease, what is it? If infectious diseases are diseases that can be communicated, spread to other person, then non-infectious diseases are diseases that cannot be spread, communicated from person to another person. And there is no infectious agent that involves in such disease. Okay, good. Now let's go to number 3. What is it? Let's talk about another terminology called patient. What's patient? Patient? How do you define patient? If someone is sick, then we say patient. Somebody is patient. Oh, this person is a patient. Why? He's a patient. The patient means someone is sick, right? Sick, okay? And he needs medical attention. Okay, I don't think this is a really good drawing, but okay, at least you will understand what I meant. So this is the guy here, very sick. Okay, I don't know what it is, but okay, they're sitting down on the chair. Okay, I'm really not a good drawer, but okay, no problem. Now you understand. This guy is very sick, so he's a patient. If this guy is a patient, then what is patient? Patient is someone who have a disease. If somebody have a disease and he need medical attention, then we call that person a patient, right? So that's the meaning of patient. Now you know what patient is. When someone tells you someone is patient, so what does it mean? Okay. Now another word is emergency. What's emergency? And people a lot of time talk about emergency. Something is emergent. Emergency, right? Emergency. They need it to be corrected easily because something is a problem. So we need to correct this problem very, very seriously and quickly. So it's emergency. A patient, when you say patient is in emergency, then the patient have or he requires immediate medical attention within an hour. Okay, that's what we mean in clinical practice. Within an hour, we have to treat the patient, and then it's it's emergency. Okay, so when we say critical, the critical cases, something is critical. Critical, what does it mean? Critical means if the emergency requires within 1 hour, within an hour, then critical required attention within seconds. Is that even possible? Treat people in seconds? So of course, that's the definition. Okay. For example, the case, if the person have airway obstruction, he cannot breathe, right? So if he cannot breathe, then you need attention, medical attention, very, very quickly, within seconds. Otherwise, that person will die, and therefore, we call this case as critical case. Okay. What about immediate? Immediate. Someone tell you, I need this thing immediately. I need it right now. I need it immediately. Go to school, go home, buy me something immediately. Well, what does it mean immediately? I don't know what it means. Tell me. You tell me. Because all of the time we use it. Tell someone, come home, come to my place, come to my office. I want to meet you immediately. What does the word immediately mean? So immediate is a care that we need within minutes. Okay? The care should be within minutes. There are two main things you have to understand. Emergency is within an hour. Critical, seconds. Though it's impossible for us to save life in seconds, but it's must that we should take care in seconds. Immediate, me within minutes. Okay? Good. What about urgent? Oh, urgently, come quickly. Required care within the golden hour. Golden hour. And they will ask you a lot of questions like that. If you're medical school, when you're taking your exam, they will ask you what's urgent, what's immediate, what's critical, what's emergency, and all those stuff. So you have to be familiar with this, okay? Okay, good. Well, what's next? We have patient. Sometimes we say this patient is inpatient and the other patient is outpatient. So what's outpatient? Outpatient, if the patient can be treated and he cannot stay in the hospital, then we call it outpatient. Okay, that's outpatient. You treat the patient and there he go. Very, very strong, and he's walking, going home. Doesn't want to stay again in the hospital. So that patient is outpatient. And if the patient can stay in the hospital, then it is in the hospital. Out the hospital, outpatient. In the hospital, inpatient. Now you understand what is outpatient and what is inpatient, right? Very simple. Out, outpatient. In, inpatient. Good. Sorry. But, well, I don't know why I'm drawing this, but this patient is going home. He's going to his house, so he's outpatient. The other patient, when he will sleep down here and stay here in the hospital, he's not going home, he's very sick, then he's not outpatient, he's inpatient. Why? Because this patient is very sick and he's staying in the hospital. Okay, this patient is so sick and he's staying in the hospital, then we consider this patient as inpatient. Okay, good. Okay, well, sometimes you go to the hospital, people talk about word. There's something called word. Okay, I don't know how you pronounce it, but W-A-R-D. How do you pronounce it? Word. Okay. Whatever the case, that's one of the things that you need to know in medical school. What's the word? The word is the room in the hospital for inpatient treatments. Okay, the word. We have outpatient and we have inpatient, right? Remember earlier? Outpatient. That's because it's outside the hospital. Oh yes, that is it. And we have inpatient. That's because he's lying down in the hospital on the bed, right? So this is outpatient because he's going home. And he's well, we treat him and he goes home. Come visit the doctor and goes home. But this person is staying in the hospital, so he's inpatient. Now, this patient, we will admit this patient in the ward. And the ward is a room in the hospital for the patient treatment. Okay, got it? Now, there are some other terminologies like etiology. I'm going to say it, etiology. Okay, what does the word etiology mean? The microorganism or agents that cause the disease. Or simply, we can say etiology is what is the cause of disease. Cause of a disease. If the disease is caused, what caused disease? That is what we call etiology. Okay, sometimes people say there is symptom. They have symptom. She doesn't have symptom. So what is symptom? Symptom means the illness. There's something that indicate, or we can say indication of the illness that is felt. Who felt it? Felt by the patient. Okay? The patient is sick. Because I have headache, I have back pain, I have this and I have that one. So that one is a symptom. It failed by the patient. But let's go down and see what is sign. Sign is the indication of disease, again, indication of a disease, but it's not felt by a patient. Who feels it? It's found out by the doctor. So it's a sign. The doctor find it out. Most of the time, they will ask you these questions. Most of the time, what is difference? The difference between. Tell us the difference between symptoms and sign. You will tell them simply symptom is what is felt by the patient, indication of disease that felt by patient. Sign is, on the other hand, is indication of disease that find out by doctor. Giving two examples. For example, if we say headache, is it a sign or a symptom? Yes, you're right, it is symptom. Why? Because it's felt by the patient, not by doctor. If we say, for example, what else? What should we say? For example, to be the sign. Okay. We say, for example, fever. The patient have fever. Okay. Is it a sign or symptom? Of course, it is sign. Why? Because the patient didn't know that he has fever. When he came to the hospital, we take temperature. We know exactly what the fever. He may know that it's hot, of course, but the fever, it's not a febrile. Okay, good. This should be enough for today. Thank you very much for watching. And once again, my name is Daniel Garang. Okay. If you have any questions, let me know. And please, down here, this YouTube, you will find a place where you have, or where you can subscribe. If you like these videos, then please subscribe. Click on the word subscribe below, and we will notify you whenever there is any new video, or by email. In other words, have a great time, and thank you very much. Once again, my name is Daniel Garang. There you go. Enough.